Hi, this is Dr. Jennie Byrne at Cognitive Psychiatry of Chapel Hill. Today I wanted to talk about 3 common misperceptions about psychiatry. And actually I could probably go on and on. There's probably about 100 misconceptions, but I want to go ahead and give you 3 that I think might be important to you. Number 1. The one I hear most commonly about psychiatry is that psychiatrists want to force you to take medication, or all we care about is medication, or that is the only thing we know how to do, or that's the only reason to see a psychiatrist. And I think that the reason that people have this point of view is that back in the 80s and 90s, there was a big reaction against psychoanalysis, which is that, lying on the couch, Freudian manner of therapy, when all these wonderful new medications came on the market and doctors were very excited that they finally had tools to treat psychiatric illness. And so in the 80s and 90s, a lot of psychiatrists really went towards being specialists in medicines, and they called themselves psychopharmacologists, and they prided themselves on having these tools to treat patients and really being specialists in using these medicines. So I think because of that time, there's this misperception out there that that's all we do, or that's all we know how to do. Another thing I think contributes to this misperception is that the healthcare system has really pushed psychiatrists into that role of doing medications. And they like to use other people like therapists or other types of doctors to manage other issues. And they really kind of push the psychiatrist into doing these very quick appointments where all you do is talk about medication. So I think that's a misperception, but it makes a lot of sense why people think that psychiatrists are only interested in medication. So I think the number 2 misperception that I hear, and this is kind of when I'm out and about and I tell people I'm a psychiatrist, they get kind of worried and they say, oh, are you reading my mind? You must know what I'm thinking. Are you analyzing me right now? And there's this idea that somehow we are mind readers, that we are trained to just sit in a room with someone and read their mind and know everything about them, and that's how we treat people. So this is kind of a strange idea, but again, I think it was popularized in some of the media and in the way psychiatrists used to speak with patients. They used to sit very quietly, not talk a lot, just kind of observe, and so it gave this idea that we were somehow reading people's minds. So I can tell you today that I cannot read anybody's mind. We are trained to be good observers and listen to people and their thought process and their speech and their body language. We are definitely trained in that, but that doesn't mean we can read people's minds. So I think that's a big misperception, and what I prefer to see the psychiatrist role, and I think a lot of people in my generation prefer, is kind of this idea that we are a partner in your health care. We're not here to read your mind. We can't read your mind. So we have to partner, and our treatment is only going to be as good as what you tell us and what you bring to us and the relationship that we have back and forth. So if you don't tell me what you're doing, you don't tell me if you're taking medicine, if you're not taking medicine, if you feel good, if you feel bad, if you feel angry, I'm not going to be able to do a very good job of treating you. So I think the misperception is that we're a mind reader, but really we're here to be a partner. And that's the best way to work with a psychiatrist, in my opinion. I think the third misperception I hear a lot is that psychiatrists are a bunch of weirdos with really weird personalities, and I really wouldn't want to go to see them because they're too kooky. And I'm not going to sit here and say that there aren't psychiatrists who have, odd personalities or who are eccentric or who don't have a good bedside manner, because there certainly are. But again, I think in our generation, you're going to see less and less of that. Psychiatry has been gaining a lot of respect, I think, in the medical field, and it's continuing to gain more respect over time. More young doctors are choosing to go into psychiatry. So I think there's a lot more people in psychiatry now who feel, quote unquote normal, easy to talk to, comfortable, who don't make you feel strange or bad. And like I said, there's certainly some people out there who are odd. I'm not going to say there aren't, but a lot of us are, pretty easy to talk to. So before judging all psychiatrists as being weirdos, I would urge you to do a little research online and maybe look at the different styles, look at people's pictures, ideally they do videos like what we're doing here so that you can kind of see what we're like before you even come and meet us. So those are my top three misperceptions I hear, and I do hear a lot of other ones, but those are three. So I hope this has been helpful. Feel free to connect with us with the information below. Thanks. Bye-bye.